name is Carolyn McLeod, and I am the Shine Counselor here in Southborough. And so today the presentation is going to be sort of a Medicare 101. Some of you may be familiar with this, but I find most people do better if they hear it more than once, because then it just takes a while for it to sink in. A lot of you probably have gotten this booklet called Medicare and You 2017. And you open it up and you try to start reading it, and your head starts hurting and your eyes start crossing, and then you call and make an appointment with me and you come and see me.
That's right.
Now, I consider myself, I would be a wealthy woman if I got $1 for everybody that walked through my door and said, I consider myself relatively intelligent, but I don't understand this Medicare at all. And I said, sit down and take a breath, and I'll be glad to help you. Okay, let's get started. So, what does SHINE mean? That's serving the health needs of everyone. That's Medicare eligible. We don't deal with people that are looking for health care through the Health Connector. That's something that we don't deal with. I have an information sheet that I hand out if somebody comes to see me that wants to buy something through the Health Connector, but I deal only with Medicare people. I'm free. We're all volunteers, which is very nice. We don't have any product we're trying to sell. We're here to help you, is what we are. So what is Medicare? That's the federal health program that kicks in when people turn 65, and it covers most medical costs. It doesn't cover things like acupuncture, holistic medicine, herbal medicine. It covers the standard health care that you get through the doctors in the hospitals. So there's 4 parts to Medicare. I call it the alphabet soup of Medicare. There's Part A, which is the hospital insurance part of it. And Part B is the medical part. That's when you go to the doctors. C is something that's called a Medicare Advantage plan. And those plans have networks. They're either an HMO or a PPO. HMO stands for a health management organization, and PPO stands for a preferred provider organization. And Part D is the drug part. Now, Part C also has drug coverage built into it. So if you pick a Part C plan, then you don't have to have a standalone drug plan. So who's eligible for Medicare? People 65 or older are eligible for Medicare, as well as the disabled population. People that have been deemed disabled by Social Security. Once they have been eligible for 24 months, they then get Medicare coverage. And also people with end-stage renal disease and ALS. So when do you enroll in Medicare? The initial enrollment period is 7 months around your birth month. 3 months before your birth month and 3 months after. And this is called your initial enrollment period. If you're already receiving Social Security, some people opt to receive Social Security starting when they turn 62. When you turn 65, you will automatically be enrolled in Medicare, A and B. But if you're not receiving Social Security, you have to enroll yourself. And you enroll through the Social Security office. You can go online or you can go in person to an office. It's the only time that you deal with Social Security and Medicare, is when you enroll. After that, once you have Medicare and you have issues, you deal with Medicare directly. So what does it look like? If you sign up 3 months before, 2 months before, or 1 month before your birth month, Medicare will go into effect the first day of your birth month. If you wait, you can see on the chart that your coverage is delayed slightly. So I recommend to people that they enroll before their birth month so that they don't miss having coverage. So who can delay enrollment? Most people enroll in Part A when they're first eligible because Part A is free. And it'll act as secondary coverage to your whatever hospital coverage you have. People can delay without penalty if they have active employment health coverage, either through their own work or through their husband's work. And you can delay enrolling in Part D if you have what's called credible coverage of some kind of drug plan. Now, those that are associated with health coverage through employment usually get an annual letter from their health coverage saying that their drug plan is considered credible coverage. And you keep those, because if you delay enrollment and you go to Social Security, you have to have proof that you've had credible coverage, or you will get a penalty. Are there any questions about that?
What does that mean? Part D may delay enrollment without penalty covered. And do you have to apply for Part D?
Yes.
And is that called Blue Medicare Rx?
No, it's called Part D, standalone drug plans, and there's a lot of drug plans.
It's one of the Part Ds, Blue Medicare.
That one is probably one of the plans.
No, I have Blue Medicare Rx.
Mm-hmm.
So do I have Part D?
Yes, that's a Part
okay.
D.
Oh, that's what's my.
Yeah.
Was supposed to be my question.
Okay. There's a lot of Part D plans, so if you give me a name, I may not recognize it. That one I do. So if you choose to delay, when you're ready to enroll, you get what's called a special enrollment period, or a SEP. And if you've delayed enrollment because you've been covered by active employee insurance, you have 8 months to enroll in Medicare after your employment insurance ends. But I don't recommend people do that, because then you're without any coverage at all. So sometimes you may end work in July and your employer may decide to keep you on the health plan for 3 months as part of your severance package, then you can wait. But if you wait beyond when your insurance ends, you won't have any coverage at all. So just people come to see me and I help them plan the timing of when they need to do what they need to do to get on Medicare, so that there's no lag in coverage. So the deal with the penalties is people get upset when they hear there's penalties involved, and they say, well, I don't take any drugs, so why should I take a drug plan? But I tell people to look at it as drug insurance. So I say you don't wait until your house is on fire to buy homeowner's insurance. You don't wait till you're in a car accident to buy car insurance. So in this case, you don't wait until you're actually taking drugs to get a drug plan and consider it drug insurance. So again, we're talking about having a special enrollment period. You can delay getting a Part D if you have credible coverage. The problem with the penalty is that it's permanent and it doesn't go away. And it's 1% a month for when you don't have coverage. Now, my father decided that my mother didn't need a drug plan when she was first eligible. The plans went into effect in June of 2006, and she did not get a drug plan until 2011. So that was 5 years of penalties that she accrued. And it's not going to go away. The good news is the penalties are not as steep as people think they are. It's the percentages of what's called a benchmark. And the yearly benchmark for a drug plan is usually around $30. So it's a percentage of $30. So sometimes it's only pennies. In my mother's case, I think her penalty is about $18 a month more that she has to pay. oops. Now, some people, when they leave work, often get Cobra coverage offered to them by their employer. What you have to know is that Cobra does not qualify as active employment, active health coverage. And if you don't pick up Part B, you're going to start incurring a penalty. But it does qualify for credible drug coverage. So you could pick up Part B, Part A and Part B, and delay enrollment in Part D until your Cobra coverage is over. But I found in general that Cobra coverage is not cheap. It usually is around $400, $500, $600 a month for Cobra coverage. And Medicare itself is a lot cheaper than that. So most people don't stay on Cobra, even though it's offered them. So what does Part A, this is a little more detail about Part A. For most people, it's free, and it's your hospital coverage. But there are what's called gaps in the coverage that Medicare doesn't pay. Medicare doesn't pay the hospital deductible, and it also doesn't pay some of the co-pays. So for instance, if you're on Medicare, just Medicare, and you get hospitalized, you have to pay about a $1,300 deductible every time you're hospitalized. Part B is the doctor's visits, outpatient care, and preventative services like colonoscopies and mammograms and things like that. The premiums vary based on your income, but for people new to Medicare for 2017, the premium would be $121 a month for Part B. And the gaps with Part B, there's some gaps with Part B. Part B only pays 80% of the doctor's costs, which means that you would have to pay 20%. There's also an annual deductible that they don't pay, and there's no coverage for routine hearing, vision, dental, and also for if you're traveling, if you have medical expenses when you're traveling. So those things are called gaps or Medigaps, what Medicare doesn't pay. So here's some things that Medicare does pay because of the Affordable Care Act, which is, some people call it Obamacare. I prefer to call it Affordable Care Act, and there's some good parts of that legislation. And now Medicare covers a wide range of screening to preventive benefits for people on Medicare that weren't covered before. So what do you do about the gaps that Medicare doesn't pay? How do you manage those if you don't want to pay for them yourself? You can buy what's called a supplement plan. And in Massachusetts, they're called Medigaps. And there's 7 of them that have been sanctioned by the state. And they pay for everything that Medicare doesn't pay for. So when you go to the doctor, there's no co-pays. When you go for physical therapy, there's no co-pays. When you go into the hospital, there's no deductible. The Medigaps pay everything that Medicare doesn't pay.
Excuse me, that is called a supplement.
Yep. So there's the one that most people know is a Blue Cross one. It's called MedX Bronze. It's been around for a long time. But as I said, there's at least 6 other supplement plans. Now the supplements, there's 2 options of supplement plans. One of them is called a core plan, and one of them is called supplement ones. Now the core covers all of the gaps except the hospital deductible. And if you are needing rehab in a skilled nursing facility for more than 20 days, the Medicare doesn't pay past day 20. And then you'd have to pay out of pocket. And usually it runs about $150 a day. So it is important to know that that's sort of a risk factor. And when I talk to people about deciding what they want to do, I talk to them about their risk tolerance. We have a lot of I have a lot of people and a lot of Shine clients, counselors, that actually have a core instead of the supplement one, which covers everything. Because they said, well, if I get hospitalized, I can afford to pay the deductible. And the cores are about half as expensive a month as the supplement ones are. The other thing about the gaps is that the Medigap plans is that they're not restricted to networks. So if you can see any doctor you want that takes Medicare patients. So if you're talking to a friend and they have an allergist they like a lot and you're starting to have allergy problems, you can go to see that doctor. You just call up and make an appointment. Drugs are not included in the Medigap plans. So then we talk about Medicare Advantage plans. Those are the Part Cs. And those are, as I said, either an HMO or a PPO. The thing that about the Part Cs is that they're networks. And you have to pick a plan that's your doctor's in the network. So when people come to see me and they're making a choice about what they want to do, I tell them to, ahead of time, call their doctor's billing office or registration office and ask them what kind of Medicare Advantage senior plans they take. Because all doctors take all supplements, but they only take certain Medicare Advantage plans. For instance, if you use the doctors at Southborough Medical Group, they take all the supplements, but they only take Tufts Medicare Advantage plans. Now there's multiple Tufts Medicare Advantage plans, but they only take that group of plans. There's premiums, and every time you go to the doctor, there's co-pays. Every time you have any kind of procedure, there's co-pays. But they also include prescription drugs. So hopefully we got to this little chart. So this is my little chart that I like the most. And I call it the decision chart. You either pick to go on the right side of the chart or the left side of the chart. No matter which side of the chart you go on, you have to have Medicare Part A and B. So the left side of the chart, you have Medicare A and B, and paying $121 for your Part B. You pick a standalone drug plan that covers all your medications. Those run anywhere between, the average cost is around $30 a month for the premiums, plus your co-pays for your drugs. And then you can decide, I don't want to just have plain Medicare, I don't like having all those gaps that I'm exposed to, and you buy a Medigap plan. The least expensive one currently is the Medix Bronze that I talked about. That's $183 a month. So I'm just giving you the figures so you have an idea of the costs.
Is that the core or supplement one?
Pardon? The supplement one.
It's supplement
Yeah,
one.
the Blue Cross Blue Shield core, I think, is around $100 a month. So that's one side of the chart. The other side of the chart is you have A and B, but then you file away your Medicare card. You don't need to show it when you go to the hospital. You're going to pick a Part C plan, and you pick one that your doctor takes, and it includes drugs, and you can get a Part C plan as cheap as $0. The monthly premium is $0. And they range all the way up to $180 plus. So, so this kind of shows the difference between the left side of the chart and the right side of the chart. It spells it out. But I talk to people about, the way I look at it is, if you're a young, healthy senior and you don't have any underlying health issues, and you only go to the doctor when you get a hangnail or you've got, you get pneumonia or something like that, the right side of the chart, a Medicare Advantage plan, is the way to go for you. The premiums are less expensive. You only go to the doctors 3-4 times a year. Your copay is $10 when you go. You're saving yourself a lot of money. On the right side, the left side of the chart, people that choose that side of the chart see multiple doctors. They have a lot of underlying health issues. They could have COPD, they could have diabetes, or they want the freedom to pick their own doctor. They want to pick any doctor they want. They want to see a special oncologist. That's people on that side of the chart. Or if you're a snowbird, if you go away for 3 months a year or longer, the right side of the chart's not going to work for you, because the only time, if you're sick and you're on the right side of the chart, you have to either go to the hospital ER or you have to go to urgent care. So you wouldn't be able to go to a doctor just for a routine, like, I'm not feeling well, I'm not sure what's wrong with me. That's, if you're a snowbird, you're not going to get any help if you're on the right side of the chart. So, and then I have people on the left side of the chart that financial issues are not a concern for them. They just want to pay their monthly premium. They don't want to have to think about co-pays. They want the freedom to do whatever they want to do. So they'll pick the left side of the chart. Are there any questions about that? So, Part D. This is the one that causes people the most trouble if you're buying a standalone drug plan. So we use a little bit later on the paperwork, there's a slide that has the government's website. It's called Medicare.gov, and anybody can go into that website and do their own search and for a Part D plan. The problem is that you have to know what you're looking at. You have to be able to interpret what you're seeing on that website. And believe you me, it's not easy. So anyway, so this is where we're going to talk about the donut hole, the famous donut hole that people find when they go on Medicare. When they're not on Medicare, they're under 65 and they have a drug plan, there's no donut hole. But unfortunately, at some point, the federal government came up with the concept of creating this donut hole. So what does that mean exactly? First, let's go with the deductibles. Some plans have deductibles, an annual deductible, and you'll have to pay the full cost of your drugs until you meet that deductible. So then the next line down, the initial coverage limit, that's where we talk about the donut hole. When the retail costs of your drugs for 2017 comes to $3,700, you hit the donut hole. And when you hit the donut hole, you have to pay 40% of the cost of your brands and 51% of the cost of your generic drugs. So I have clients that are on costly drugs, and they hit the donut hole in January, and then they're pretty much stuck in the donut hole until they get to the out-of-pocket threshold, which in 2017 is going to be $49.50. And when you hit that, you go into what's called catastrophic coverage, and the federal government covers the cost of your drugs except for 5%. So for some people, $4,950 worth of drugs is a big burden on them. So the good news is that because of the Affordable Care Act, the donut hole has been shrinking. Before the Affordable Care Act, when you hit the donut hole, you paid 100% of the cost of your drugs. It's slowly shrinking, and by 2020, the donut hole will have shrunk completely and go away. So what you pay in January, you will pay in December.
Regardless of the election.
Well, if they repeal the Affordable Care Act, then the donut hole will continue to exist. Will continue to exist. But we don't know what may be put in place of the Affordable Care Act. So there's some good things about the Affordable Care Act. Getting rid of the donut, shrinking the donut hole, and doing away with with preconditions, so you can change plans. So the Part D plans differ a lot, and they're getting more confusing. When I first started as a Shine counselor, you picked a Part D plan and you could go to any drugstore you wanted to. Now, the drug companies have negotiated with the drugstores and have picked up what they call preferred pharmacies. And so when I'm doing a search for somebody on a Part D plan, I put in some of the big hitters like Walgreens and CVS and look to see which drugstore is the best for them, and I tell them which drugstore to go to. Because like Beth used to go to Walgreens, and then we switched drug plans for her, and now she's going to CVS. If she'd continue to go to, now I don't, maybe it's back to Walgreens because we usually switch you almost every year. But if you go to the wrong drugstore, you could pay 100% of the cost of your drugs, or a bigger portion of the cost of your drugs by going to the wrong store. So that's one of the things that you have to put in the tool now, this Medicare.gov website. You have to pick some drugstores and put them in and see what the cost differences are. Also, they have what's called formularies, which is a list of all the drugs they cover. So when I'm doing a search, I look to see if the drugs you're on are in the formularies for the plans we're looking at. They also put their drugs on tiers. So there's up to 5 tiers. The preferred generics are tier 1, the non-preferred generics are tier 2, preferred brands are tier 3, and sometimes the deductibles only are affected by tier 3 and higher drugs. So sometimes if your drugs are all tier 1 and tier 2, even though there's an annual deductible, you won't pay that deductible because your drugs are not included in that deductible formula. Also, there's restrictions. There's restrictions called quantity limits. So when you come to see a Shine counselor, you need to bring a list of your drugs, the dosage amount, and how often you take them a day. Because some drugs are limited to 1 a day, and if you take 2 a day, then we have to find a plan that doesn't have that restriction. Some plans have prior authorization to take a drug. Usually that prior authorization is around a drug that's brand. Unfortunately, Medicare doesn't like brands. They like you to take generics. And if the kind of medication you have has a generic associated with it, they'll make you and you want to take the brand, you're going to have your doctor get prior authorization to let you take that brand. They also have something called step therapy, which is, again, if you want to take a brand and there's generics associated with it, they make you the first step you take is you have to take a generic and see if it works. And then the second step you take, may try another generic and see if it works before you get to the point where you could take the brand. Does anybody have a question about that? So when I'm doing a search on the website, I try to find plans that don't have any restrictions associated with them, so that you don't have to worry about that. And again, I mentioned that they all have networks of pharmacies now. One of the cheapest plans is a Humana Walmart, but you have to use, if you want to go to the drugstore, you have to use Walmart, the Walmart pharmacy. But they do have the cheapest mail order. They have a mail order where your drugs can cost you nothing. The co-pays are 0. So if you like using mail order, that could be an option for you. So this annual enrollment period is my busiest time of year. It starts on the 15th of October and ends on December 7th. And this is for coverage starting in January 1st. And I tell people if you're on a HMO or a PPO, a Part C, you don't necessarily need to come see me because those plans don't change that much. But the Part D plans change a lot. They they take things off the formulary. I had somebody come see me last January. She had a plan that worked the year before. She went in January to get her drugs filled, and she had to pay full price because it had been dropped out of the formulary. So people with standalone Part Ds should see a Shine counselor annually to have their plan checked. You do get what's called an ANOC, Annual Notification of Change packet from your plans, whether they're Part C plans or Part D plans. You'll get a pack, it's about this thick. People get it, and they do the same thing with this. They just file it away and they don't look at it. If you're on a Part D plan and you're not seeing a Shine counselor, you should open that packet. Usually there's a summary letter on the top that mentions the major changes, and then you should check the formularies to see if your drugs are still listed in the formulary and still listed in tiers that you thought they were in. So besides doing Medicare, I help people with Medicaid. And in the state of Massachusetts, that's called Mass Health. And when people come to see me, I screen them to see if they're eligible for any of the state plans. There's one plan that's called Prescription Advantage that doesn't have any asset test. It just counts on your income. And it's a wonderful, easy plan to apply for. And it gives you two advantages. One, it helps you when you fall in the donut hole. So instead of paying the 51% or the 40%, you pay a flat rate, which is usually $7 for generics and $30 for brands. The other thing it does is that it allows you a special enrollment period once a year. So if you're in a plan that's gone bad for whatever reason, and you have Prescription Advantage, you can change plans, which is a huge advantage for some people. That's just one example of one of the plans that I screen for, one of the state plans that I screen for. So
I think we're at the end.
I was talking about the Affordable Care Act, which I already touched bases on. So. And then it just has the phone numbers to call for people in Southborough. You just call the senior center, they book my appointments. And you do not have to be a Southborough resident to come see me. I don't restrict people based on where they live. There's also 2 wonderful counselors in Westborough. There's, I believe, 3 counselors in Northborough. And I think there's 4 counselors in Sudbury. So if I get booked up during open enrollment and you can't get in to see me, you can try one of the other senior centers. And they also have multiple Shine counselors at the Callahan Center in Framingham. They beefed that up, that group up during open enrollment to take over the overflow from the other senior centers. So there's always someone to help you.